But to continue with the program, we welcome to the stage Daphne from Aube. Sorry. Honestly, I'm not French. Sorry. Aube. So Daphne Elisma, sorry. I'm butchering it today, sorry. Has been a medical cannabis patient since 2014 to treat chronic migraines and alleviate debilitating symptoms of complex regional pain syndrome following breast cancer. Formerly a Quebec representative of Canadians for Fair Access and Medical Marijuana, she also serves as an expert advisor for the Health Committee in the Canadian House of Commons regarding Bill C-45 concerning medical cannabis. We welcome Daphne to the stage.
Bonjour, greetings. Greetings, ladies and gentlemen, and distinguished guests. First, let me begin this presentation with expressions of gratitude. I'm grateful for the hard work and dedication of all the participants and sponsors of this event. First and foremost, I would like to thank C3 for the opportunity to participate in this edition of Grass on the Hill Fall 2022. As you know, my name is Daphne Elisma. I'm a jurist and the founder of Aube, the voice of medical cannabis patients. Aube's primary vision is to build an evidence-based community of support for medical cannabis and to put Quebec at the forefront of cannabis and cannabinoid research and public education. Our main objective is to promote and defend the rights of medical cannabis patient community while helping to raise financial resources to fund clinical research and the advancement of cannabis and cannabinoid education. This is an essential step for our community to promote access to cutting-edge treatments for patients suffering from chronic disease such as cancer, multiple sclerosis, epilepsy, arthritis, and other disabling conditions. Our organization brings together patients as well as professionals from many sectors such as healthcare, philanthropy, government, municipal, business, the cannabis industry, academic, and legal fields. With this initiative, we want to encourage the government to develop more progressive policies and reduce unnecessary barriers and difficulties for medical cannabis patients. My roots in medical cannabis patient advocacy are born out of being a patient myself. Residing in Quebec, I am aware of the many barriers to accessing medical cannabis in Canada. Despite the many stigmas associated with cannabis, Canada has made a bold move by becoming the first G7 country to federally legalize this plant for recreational use, which for some is a danger, and for others, the only way to alleviate their health condition by using it for medical purposes. Aside from being one of the very first countries in the world to legalize recreational cannabis in 2018, most people are unaware that Canada has been a globally pioneer in legalization of medical cannabis for years and has been since 2001. In our view, Canada needs to move from being a pioneer to a leader in the medical cannabis field. Indeed, our country has come a long way since the landmark Parker decision in 2000, where the Ontario Court of Appeal ruled that the Controlled Drugs and Substances Act prohibition of cannabis possession has deprived Mr. Parker of his right to security of the person and liberty in a manner inconsistent with principles of fundamental justice. Later, in 2014, in another important decision, the Supreme Court of Canada ruled in R.V. Smith that patients must have access to a regulated sources of supply of all products in all forms and concentrations. This decision declared it unconstitutional to restrict legal access to only dry form of cannabis. And I would say that despite these advances, medical cannabis patients face more barriers than ever in accessing this therapeutic product. This will be the focus of my clinic on behalf of the patients I represent here today. So our organization aims to be a vector, an agent of change, specifically against the long-standing health discrimination represented by the taxation of medical cannabis, which has emerged as the principal problem in terms of access and affordability for many patients with legal access to medical cannabis in Canada. The federal government's imposition of an excise tax on medical cannabis is totally unacceptable and inconsistent. This tax is usually applied to tobacco and alcohol, a tax that some call a vice tax or a sin tax. Applying it to medical cannabis, in our view, creates a social injustice and demonstrates a lack of understanding of the various barriers faced by patients and represent a failure in terms of public policy. After overcoming many barriers and demonstrating that medical cannabis is the most effective treatment for their health conditions, patients are also facing significant financial obstacles. As for many, this medication is very expensive. So to encounter this problem and to improve access to medical cannabis in Canada, our organization encourages the adoption of policies and programs that facilitates the coverage of medical cannabis costs on the public and private plans. In our opinion, considering that patient obtained medical cannabis through a medical document issued by a healthcare professional and for medical necessity, it is essential that medical cannabis patients be eligible to pharmacare for all. All patients must be eligible for a national pharmacare program so that everyone, and I say everyone, can have access to the medication they need to maintain their physical and mental health without any financial constraints. We also encourage the government to develop and implement a national pharmacare program and to include medical cannabis on the national list, of federally and provincially insured drugs. We sincerely believe that these initiatives will have the effect of improving the quality of life of our patients, who are often the most vulnerable in our society. And on the research side, there is a little, if any, high-quality research being done on medical cannabis. This is due in large part to the lack of funding and the complexities and requirements and delays to the approval process for research license. As a result, researchers in medicine, agriculture, pharmacy, for example, are doing less or no research, even though they have an interest in advancing scientific knowledge about medical cannabis. Therefore, physicians and nurse specialists with little training on cannabis during and after their studies are very often more hesitant and reluctant to provide medical authorization for medical cannabis and to develop care plans that include it. So we believe that Health Canada must ease requirements and expedite the approval process for research licenses so that Canada becomes a leader in cannabinoid research. And particularly on the following four priorities, we know that safety, efficacy, dosage, and administration, these are important fields that needs to be studied more in depth. Canada must not lose the advantage of being one of the first in the West to legalize access to medical cannabis as well as recreational cannabis. À vous, membres du Parlement, représentant les électeurs des 4 coins du pays, je m'adresse à vous dans la langue de Molière afin que vous puissiez être une voix forte au Parlement en matière d'amélioration des droits des patients ayant recours au cannabis médical. Je vous encourage à appuyer toutes les initiatives qui auront pour objectif de faire de notre pays un leader en matière de recherche et d'innovation en lien avec le cannabis médical. En effet, nous avons sur notre territoire des universités, des cliniques, des groupes de patients qui travaillent sans relâche à l'amélioration de la recherche clinique et à l'avancement de l'éducation en cannabis et cannabinoïdes. Nous devons permettre que ces acteurs importants de notre société puissent compter sur l'appui du gouvernement pour arriver à atteindre les objectifs de bien commun. On the other hand, we welcome the fact that the federal government has taken a comprehensive approach to its review to the Cannabis Act, and we encourage our government to take major steps in reducing stigma, removing taxation, and increasing resources for medical cannabis research, access, and education in our country. Throughout this process of revising this historic legislation, we would like to remind the government of the importance of keeping the perspective of medical cannabis patients at the heart of the discussion. And during this legislative review, we also want to make the legislator aware of the importance of understanding the impact that these discriminatory medical cannabis regulations have on the lives of medical cannabis patients. We look forward to continuing to build strong partnership with stakeholders involved and to working alongside medical cannabis patients. Together, we will succeed in making sure that the general public understands that cannabis is more than a recreational substance or drug, and that many are still struggling to obtain just and equal access. We will be relentless in our effort to achieve results and address inequities by working in a constructive manner to improve the rights of medical cannabis patients and to allow patients to integrate into society by removing the various undue constraints they have faced for too long. We will continue to advocate for vulnerable populations and their ability to use cannabis in a safe and supportive environment. In closing, I would like to invite you to visit our website at aubepatients.ca to join our fight and support our cause. These patients we represent come from different backgrounds and generations. They may be a family member, a friend, and a neighbor. We really must give them a voice. Once again, my sincere thanks to the Cannabis Council of Canada for this invitation, and on behalf of the patient that I represent here today, have a great evening.
Thank you so much, Daphne. I don't know if we have any questions or comments. No? Oh, okay, perfect. Okay. Head of the game for me.
Thank you very much, Daphne. I'm Myrna Gillis from Aquilitas. One of the things you highlighted sort of in the trilogy of cases that you referred to was about the A to access, which of course didn't get followed by the most important, which is affordability. And as we know, as disability advocates, most people with disabilities are marginalized and very often don't have income. Some of them, like the High Hopes folks, may not even have addresses to vote from, and here we are sort of at a lobbying event where the golden vote and the voice is very underrepresented in populations with disability. So my questions are twofold. The first is, do you think that and the other part is that we're not here today because of the generosity of any government. All of this was forced through court challenges. And do you think the second A, being affordability, is really something we're only going to advance through charter litigation, firstly? And do we know, Because the other thing that seems to push parliamentarians is, do we have any of the trickle-down benefit analysis of a high hopes or of what other benefits we are saving economically when we have affordable access to medicine that reduces harm or reduces other expenses that we could use in these discussions?
Well, I strongly believe that events like today is really important. I think it's important to keep on lobbying the government instead of going to court. I think it's important that we push on the lobbying for the government to change their ways, change their regulation, improve access, improve affordability for patients. I think it's one of the things that we need to keep pushing is lobbying and see how we can make changes through different regulation and for more access for our patients. What was the second?
Just if you had any of the economic analysis of how assisting affordability, is there any other economic argument that we can rely on other than doing what is right and what is compassionate that may not motivate all of the people that we're in front of, but other sort of supplemental information?
Well, like I just mentioned in my presentation, our organization, we're really going to push forward for government to include cannabis into the pharmacare that is in discussion, for them to add medical cannabis into the list of national covered medication.
Yeah, and definitely, I mean, that's a provincial and federal, obviously, income assistance and Medicare and pharmacare programs provincially.
And also, like Joanne was saying, I think one of the other avenues that we also have is pharmacy distribution. That's another great avenue that needs to be more addressed when we meet with government officials. So for us to have cannabis in pharmacy, it's something that we've been asking for years.
Thank you so much, Daphne. Thank you.